Welcome, everybody. We are so grateful to have you all here arriving for this very important day. It's a very important topic, and we've got an amazing group of people who are going to be sharing their knowledge and experience and perspectives with us. We are very grateful to welcome you all with us. And I want to begin by acknowledging that I am in Mi'kma'ki. This is the ancestral and unceded territory of the Mi'kmaq. Their inherent rights to this land were recognized in the peace and friendship treaties, which Mi'kmaq, Wolastoqiyik, and Passamaquoddy peoples signed with the British Crown from 1725 to 1779. This series of treaties did not surrender Indigenous land, resources, or sovereignty to the British Empire, but instead established rules for an ongoing relationship between multiple nations. The treaties were later reaffirmed by Canada in Section 35 of the Constitution Act in 1982, and they remain active to this day. The Nova Scotia College of Social Workers joins our members and our communities in the necessary labor of reconciliation. We are grateful to live and work together as treaty people in Mi'kma'ki. Without action, acknowledgements are empty. Whether you are with us in Mi'kma'ki or joining us from elsewhere, please consider whose territory you are in, your relationship with that land, and your relationships with the Indigenous peoples who have lived and continue to live in that place. We invite you to reflect on how each of us, as individuals and as a collective body of social workers, can hold ourselves accountable to reconciliation with Indigenous peoples here and across Turtle Island. Walalu, thank you all. Nova Scotian social workers and the people they work with and walk alongside have diverse origins: Indigenous, arrivant, settler, and refugee. Today, as we dive deeper into learning about the shadow pandemic and how to take an Africentric social work lens to addressing these issues in a culturally competent way, we take this moment to recognize the deep history of communities of African descent and the 50 African Nova Scotian communities that exist throughout the region to this day. These communities have enriched this region with their labor, culture, and creativity for over 400 years. They have been and continue to be pivotal in shaping our society. Advancing Indigenous sovereignty and Black liberation are deeply and inextricably tied. As social workers, the values of our profession demand that we commit ourselves to continually learning more about how we can deeply engage and move forward the work of truth, reconciliation, and equity for all people. Recognition marks the beginning of the work ahead of us, not the end. Today, we are just going to have a long, wonderful day. And I wanted to just go over the schedule for the day. We are beginning with our welcome. We're also going to have some breakout sessions so that you can each meet a few of one another. And our panel will begin with research at 11:30. There will be a break for lunch around 1-ish. And at 1:45, we will be having our second panel, which will have service organizations speaking about how they have dealt with the pandemic and the needs that have arisen during the last few years. And then we will conclude with the researchers coming back together to talk about advocacy and next steps. You stay through the whole day, you will be eligible for door prizes, and we will be able to not only start the day right, but end the day hopefully in a place of centeredness, aligned with our commitment to being able to move forward to do good work in this world. And we are grateful to our elder, Ella Paul, who in a few moments will be helping us start right. I do want to just talk a little bit at the very beginning about Social Work Month. At many of our events throughout the month, we are giving away many, many books, including some of the ones here, but others as well. And we're also going to be giving away some artwork and conference tickets for our conference in May. So you definitely want to stay tuned. You are only eligible for the prizes if you sign up through Eventbrite, so that's how we get your names. And if you are able to stay till the very end. So if you're not present when we do the prizes, then we will go to the next person. I also want to just call your attention to another very important advocacy event, which is going to be held on March 16th. Social work is different than other helping professions precisely because we are committed to social justice and advocacy and recognizing that people are part of a larger whole. So you will see that we have a tremendous amount of different sessions that are coming up for the month of March, but we're especially excited about two advocacy events. One that will be organized with the Canadian Mental Health Association to try to ensure feedback into the development of our mental health strategy with Dr. Sam Hickox, who is with the Office of Mental Health and Addictions. And then our beloved senator is going to be helping us with the Canadian Centre of Policy Alternatives to advocate with other policymakers to ensure that important values such as anti-racism and decolonization and issues of justice are interwoven in every policy. So these are very important sessions. We have, of course, a lot of other awesome learning opportunities and self-care opportunities, yoga, meditation as well. So we hope you join us for all of this. I am grateful, of course, to our research and advocacy speakers. We will have a chance to meet them more in full in a few moments, and also to our service panel speakers. And we will be having breakout sessions in a few moments. I will explain a little more about that. But right now, I want to stop share, and I want to invite our elder, Ella Paul. Many of you may remember her because we were so blessed to have her help us open our conference last year, our first Zoom conference, and look at us now. So I'm going to be quiet and thank you.
Thank you. Thank you so much for inviting me to be to help open this conference. I'll be here, try to be here as much as I can, but I may have to step out. I have to pick somebody up. But thank you again for inviting me, and welcome to Mi'kma'ki, our land. I would like to start with a prayer. I pray, grandfathers and grandmothers, I pray that you walk with everybody who is here, people who are listening, people who are presenting. I pray that you give them, open their hearts and their eyes and their minds to what is best for the people they work with, that they're able to help them in ways that are not harmful, that sometimes helpers harm instead of help. And I pray that you you give them the courage and the insight to do things properly. And I pray that you have a successful meeting. Nogama, again, thank you for inviting me. Bye.
Amen. Thank you so much. We are so honored to have you with us and grateful. Thank you. I want to now invite Alec, our executive director, to say a few words.
Thank you, Ella, for that opening blessing. And a big thank you to Anne, Rebecca, and Suzanne on the NSCSW team who have worked hard to bring to light this conference today, as well as you just saw the agenda for a very robust and jam-packed Social Work Month. And I do hope that folks are able to join us along the way. I'm delighted to bring some more greetings today and to welcome, of course, all of our members and those joining us from outside the profession today. In March of last year, Canada was hopeful that the year ahead would provide us with the opportunity to take a collective sigh of relief. And though vaccines have provided hope for a path forward, this last year was more difficult than ever for social workers in Nova Scotia and across the country. And so the theme for this year is reflective of that, which is in critical demand. Social work is essential. I'm happy to share a message from the three pillars of the profession: education, regulation, and practice. And note that the NSCSW is a proud partner of our national affiliates. Throughout COVID-19, social workers' roles are more critical than ever as the pandemic continues to widen and the pre-existing gaps in our social safety net become even more apparent. And despite all your personal and professional challenges, social workers have continued to rise to the occasion, providing exceptional services, care, and leadership to people and communities across Nova Scotia and Canada. Doctors and nurses are rightfully heralded for their contributions throughout the ongoing pandemic, and it's important for the public to also be aware of the essential profession of social work. I remain incredibly grateful to each and every one of you who serves your communities with empathy each and every day while pushing and advocating for a more fair society as we continued in our shared efforts towards social justice, equity, and critical self-reflection as we advance reconciliation, anti-racism, and equity and push for equality. This March, we celebrate your amazing work even more loudly than ever. But though National Social Work Month is a time to celebrate, it's also a time to reflect. And this year's celebration must go hand in hand with the recognition of the very real, very serious, indeed critical difficulties faced by our profession. Even prior to the pandemic, social workers were often overlooked and underpaid, and many social work students continue to navigate unpaid practicums. But now, as you continue your essential work, through the third calendar year of a once-in-a-lifetime generation pandemic, we know the profession and the personal situations for many social workers are critical. While we acknowledge and celebrate the extraordinary devotion of social workers and their pivotal roles, especially in the context of an unprecedented world pandemic, we remain aware of the urgency of our opportunities for growth. The uncovering of mass and unmarked graves of stolen and beloved Indigenous children on the grounds of former residential schools across the country brought renewed global attention to the historical and contemporary realities of colonialism in Canada. The ongoing efforts to locate and honor these little ones reminds us of an active involvement of our profession in colonial violence and our collective responsibility to continue to transform this legacy and champion decolonial change. The ongoing centering of whiteness and the subsequent systemic violence of anti-Black, anti-Asian, and anti-Indigenous racism, anti-Semitism, and Islamophobia we have witnessed during the pandemic continues to remind us of the responsibility of our profession in preserving inherent social work values grounded in integrity, ethical practice, and equitable service to humanity. So they are being practiced and taught in a consistent, anti-oppressive, and sustainable manner. Despite these challenges, it is fundamental to our profession to close with a message of hope and resilience. As a profession grounded in principles of social justice, optimism comes naturally. We are secure in that our profession is united in our shared commitment to sustain social change and to continue to transform the legacy of our profession through our daily efforts on the front lines, in our classrooms, and in our offices. For our part, our respective roles and alongside those of the most vulnerable before governments and policymakers and in regulating the profession, we are working for a better future for social workers, those they serve, all Nova Scotians and Canadians. Last year, the theme for National Social Work Month was Social Work is Essential. It was chosen to reflect the essential roles of social workers played not only before and during the pandemic, but also the ones they will play in a just recovery. This year, while the situation may be critical, we are more certain than ever you will be critical to the brighter days ahead. thank you all for joining us today, and I know it's going to be a powerful session.
Thank you so very much. I appreciate you and your greetings. Appreciate everyone who's gathered, and will be gathering with us. I know that it's a very intense day. It's a very intense topic. And so I did want to just take this moment to invite everyone to reflect on recognizing that this topic can bring up difficult feelings. What strategies do you find helpful when you are feeling uncomfortable? And are there any strategies that might be helpful to use today? We want to take this time to remind ourselves that we are not alone in doing this work. And while sometimes living in a world of Zoom makes us feel like we're all alone, we are actually connected to one another in very profound ways. And so we are going to be having breakout rooms. If you're not familiar with breakout rooms, you will have an opportunity to join a breakout room. You will have an opportunity to be grouped into different groups in order to try to get to know each other and share a few strategies and just be able to focus on being centered, so that when we gather back together at 11:30 to begin our panel, we are reminded that we can and should, as Alec reminded us, be wading into uncomfortable territory in order to begin dismantling the oppressive structures that have created so much of the world that we live and work in, and that we are working to dismantle all forms of violence and oppression. And today, may it be a step forward towards that. So with that, I am going to be dividing up into breakout rooms, and you will have an opportunity to go into breakout rooms. We want you to just say, join the breakout room. You can always ask me to come in order to assist you. And then you will have a chance to come back together. I will give you a notice and you will automatically come back. It's one of the mysterious components of technology in Zoom, which allows us to stay connected. So with that, please introduce yourselves and take this moment to reflect on what strategies help you.
Hello, my name is Nancy Ross, and I'm really pleased that so many people have come out to hear this research. It's been a journey for all of our team. We've had a very diverse team, and we've been meeting for the past 2 years. And our research project is called Culturally Responsive Healthcare to Reduce Gender-Based Violence. Initially, we applied for this grant in the spring of 2020. So we've all had quite a journey in the past 2 years as we've been meeting and sharing. We've had some very powerful sharing of ourselves personally and hearing sharings of others. And we've learned so much. And I think it's called on all of us to be very open and to be reflective. So when we first applied for this grant, it was a partnership between myself at the School of Social Work at Dal with Senator Dr. Wanda Thomas Bernard, and the Association of Black Social Workers, and Sue Buchen, Executive Director of Be the Peace Institute. And then along the way, we were able to welcome Dennis Adams from LOVE, which is Leave Out Violence. And so we've had a wonderful time meeting, and we're going to share a little bit about what drew us to this work and what keeps us in this work when we do introductions. So I'm not going to introduce the team. They are all going to introduce each other. But one thing I will say is that having been involved in this, engaged in research around this topic for it seems over a decade, and involved in direct work related to that, probably 2 decades before that. Historically, this topic area has been described as fragmented, lacking in coordination, lacking in funding, and characterized by silence. So when you think about how many people are coming today and this workshop, it's really a step forward in shining a light on this topic area that's persistent. The gender-based violence has been persistent, and we've seen it elevate during the pandemic. And we also know that during the pandemic, issues related to race, and particularly for African Nova Scotians, have been highlighted as well. So I really welcome all of you again, and I want to now move so that we can, each member of the team can introduce themselves. And what we thought we would do is have each member of our team introduce themselves, and maybe we can go to the second slide, Steph, and maybe say a little bit about what has kept them with us for those 2 years and what this work means to them. Because for each of us, I think that it's heartfelt. So maybe since I'm already speaking, I will lead that off by saying, for me, when I received an email from Dr. Wanda Thomas Bernard, Senator Dr. Wanda Bernard, probably in March or February of 2020, asking who may be interested in partnering with her to do a research project and respond to this particular call, I jumped at the opportunity. And I'm so glad that I did. And one of the things that I have found in terms of the research is that there's a distinct lack of research focused on African Nova Scotians, and our prior research had confirmed that. So that has kept me involved and very enthusiastic. And also I find for myself personally, professionally, and politically, this research has meant a great deal. So with that, I'm going to move on to other team members to introduce themselves.
Maybe I'll jump in next, Nancy.
Sure.
So I would say that when I saw the call, I actually sent an email to several researchers. Not that I was inviting myself to be a part of it, but basically I wanted to make sure people knew about it. And Dr. Ross was the only person who responded to my email. Can you imagine that this topic wasn't of interest to a lot of people? For me, my interest in this is really, I would say, my life's work, coming together and bringing this work around gender-based violence, work around culturally responsive services, and work around addressing the dual pandemics of anti-Black racism and the pandemic of COVID. The opportunity to do that with a team of people who are equally invested has been a real pleasure for me. And now I'll pass the torch on to the next member, maybe Sue. Maybe we could each pass on to someone. I'll pass it to Sue.
Thank you, Senator. I'm Sue Buchen from Be the Peace Institute, and we are a small nonprofit devoted to addressing the roots and consequences of gender-based violence and tackling it through a feminist, intersectional, systemic lens, and the ways in which gender and racial and other social inequities keep gender-based violence entrenched and really impede our progress in trying to end it. So this project built on one that Be the Peace Institute did with the Association of Black Social Workers, which really became a personal journey for us towards allyship and reflection and unlearning and learning about anti-Black racism and the urgency to become authentic allies in that. So it was a great opportunity to work with the Senator and with Nancy Ross again, and this particular team has been really quite a moving experience. And I'll pass it on to Trisha.
Thanks, Sue. Trisha Crawley. I'm from the community of East Preston. So I was a research assistant on the team. I guess the reason for me, I guess it's just to see how gender-based violence has affected my community, and the fact that I was just able to see firsthand from the kitchen table talks. Just hope to make a change when it comes to the culturally responsive care piece. I think that just for me, I haven't experienced gender-based violence, but I just see how important culturally responsive care is, and just how many of the stories that I listened to through the kitchen table talks that I was able to relate to from my experiences being, in hospitals, doctors' offices, etc. And it has been such a pleasure to be part of this team. Yeah, we've had some very interesting conversations. So thank you, and I'm going to pass the torch on to Kassan.
Thank you, Trisha. So I joined this research team because Senator Thomas Bernard invited me to be part of it. I had just completed her Africentric social work course at Dow, and she invited me to participate, and I was honored. And I mostly, in the beginning, started off with transcribing and coding the data, but through kind of all of our discussions that we've had about the topic, it's become very clear that it's such an important topic to be discussing, and that we owe it as service providers to make sure that people in the community are receiving culturally competent, culturally safe services and care. So I think it's just being part of a team that is trying to achieve that is amazing. And yeah, so I'm very excited to be here today, and I will pass the torch off to Dennis.
Thank you very much. Dennis Adams, I'm the ED, or what I would rather call myself, the Chief Harmony Officer. That's what the staff calls me. I like that. Chief Harmony Officer for Love Nova Scotia. We're a youth development organization, and hopefully a real good one. I hope we are. It's an honor to be here. I'm a Black male, of course, with the team that I think I'm the only Black male. So I'm honored to be here. A little bit about me. I'm raised by a mom and 5 sisters, 1 brother. So I'm very comfortable in the setting I'm in. And I do consider myself always looking from a feminist lens. So that's how I see the world. So this topic reached out to me and grabbed me, quite honestly. What else can I say here? Why did I stay with the project? I wrote something down here. It's personal, of course. It's personal to me for what I've seen, what I've witnessed in my life. Truth and honesty are very important to me. This team represents that, truth and honesty. And the African Nova Scotia experience hasn't been highlighted in a way that's the way it is, which is prideful and beautiful and great, and misunderstood, if you will. So this is another way we can tell that story better. Thank you. And I'll pass it on to Abiwa.
Thank you, Dennis. Good afternoon. Sorry, good morning, everyone. My name is Abiwa. When I joined this research, it was a research opportunity, like a research assistant opportunity, and I was just going into grad school. So I saw it as an opportunity to learn from Senator Bernard and Dr. Nancy Ross at the time. But as I went deeper into this research, and as a Black person, an immigrant, I began to see certain reasons, and hearing first voice from people, I began to learn from people's experiences, and I saw how these things related to me as a Black person. I'm not indigenous African Nova Scotia, but growing up back home in Nigeria, I have seen where gender-based violence have been perpetrated, even though I was really young when it happened. So I didn't relate that to gender-based violence, but the more I went into this, I began to learn more and see that, okay, all those you experienced around you as a child are signs of gender-based violence. And then being here, now living in Canada, I know this is something that would really be important to me, my family, my kids, and everyone, now that I'm a part of the African Nova Scotian community. So I really want to, it like brought me closer to this and helps me understand certain things, how they're going on in the community, experiences of people, and how gender-based violence is being perpetrated. And I've learned so much from the team, and I'm really grateful for that. Oh, I will pass the torch to Divine. I'm sorry.
All right, I think Divine might be having some difficulties unmuting.
Can you guys hear me now? Sorry.
Yes.
Okay, perfect. So good morning, everybody. My name is Divine Beve, and I work with the East Person Empowerment Academy as a program coordinator. So this opportunity came to me, I'll say, late last year when I was doing my field placement with the Association of Black Social Workers in 2020. Senator Bernard came to me and told me about this opportunity, which would give me the chance to work with some amazing people I feel like in the social work community. So once I got this opportunity, it really was kind of a no-brainer to take it and just learn. I think what really made me stick with this was really hearing from, the perspectives of individuals when we did the KTTs. I believe Trisha and Abiola, we all work very closely on that, and just hearing, the experiences of individuals when seeking healthcare services and seeking all the social services and the challenges and the barriers that they face, that really touched me and impacted me as an African Nova Scotian, that, I'm able to now be a part of a research that sheds a light on that really kind of drew to me. And I've decided to stay on to see it through, to provide the little knowledge that I can to this research, and also to really learn from not just my coworkers here, but also to learn from the community at large. So thank you very much.
And we need you to call on one of your...
Yes, I believe I am the last person, so I'm going to pass it right back to Nancy.
No, we haven't heard yet from Stephanie.
Oh, yes, yes, my apologies, yes.
No worries, there's lots going on. I'm Steph, a PhD student at Dalhousie. I'm also a director of research and fund development at Love Nova Scotia. And I came to this project with my own lived experience of being a survivor of interpersonal violence and experiencing firsthand criminal legal system as a victim witness. And so that's the lens that I really bring to this work. And I also come as a learner, really absorbing a lot from the project, from the team, from the diverse experiences. And it's been an honor to work with a group of people who show up and are committed to this work. And I'm looking forward to the rest of the day. And thank you, Nancy.
Thanks, everyone. So as you can get a sense of how awesome our team was, and how it's been such a joy for all of us to be engaged in this work together. Even though it's tough and challenging work, it's been really, I think we could all say like we felt a certain camaraderie, support, and that it was fun at times. So what we want to move on to next is just acknowledging the variety of support we've had from different funders. So Steph, if you could move that slide along. So we've had a lot of funding from different groups. So initially we applied to the Nova Scotia COVID-19 Health Research Coalition, and they provided the initial funding. And then we have received additional funding to hire world-renowned, I'd say, Juanita Peters to do 3 film clips that are in the works. And some of the funding for that came from the Dartmouth General Hospital Foundation. We've also received funding from the Nova Scotia Advisory Council on the Status of Women, and we've also had 2 MyTech Research Training Grant Awards. And I think, Wanda, you were going to speak a little bit about the funding for the knowledge dissemination.
I'll just very briefly say that oftentimes there's not enough money in a research project to take it to the next level. And we've been fortunate to receive some funding again from the Association of Black Social Workers, the Advisory Council on the Status of Women, the Dartmouth General Hospital Foundation, specifically funding the film, some of those film clips, and the Progressive Senate group, which I'm a part of. And we've also had in-kind support from Dalhousie School of Social Work and also the Nova Scotia Association of Black Social Workers. So we're very grateful for all of the support we have received.
Okay, thank you. Now we'll move to the next slide. So in terms of the agenda today, we want to talk a little bit about how this research has built from previous research, then identify a little further the goals and objectives of this current project, the data, and describe the data that we collected. Then I'm very excited to have Senator Dr. Wanda Thomas-Bernard share how we engaged in Africentric analysis, and then discuss some emerging themes, and then overall an overarching summary of what we have learned, and then to end with a question and answer period. So that's the agenda for today, and I'm hoping we're going to manage to get through that in the time allotted. We will try our best.
We will. This work certainly builds on a previous research that I led called the Racism, Violence, and Health Study, which was done in 3 Canadian cities and ended up with the book Race and Wellbeing. So looking at the impact of racism, there were hints about gender-based violence within that work, but we did not have the opportunity to really fully develop it. And this feels like a nice extension of that.
Yes, it's thanks, Wanda. Thanks, Senator. I'm going to try to remember to say Senator Dr. Wanda Thomas-Bernard, but I've come to, over the process of these past years, to know her and think of her dearly as Wanda as well. So in terms of the Weighing Justice in Nova Scotia project, this was funded by Justice Canada, and that was funded in I think 218 to 220, or it might have been 219 to 221. And during that project, we looked at the impacts of pro-arrest, pro-charge, and pro-prosecution policies as a response to gender-based violence. And in that research, we were able to conduct a scoping review of all the literature related to the impact of these policies. And we found only one article related specifically to the experiences of African Canadians. So this lack of research and attention really helped inspire and infuse this current research project. And then Sue?
The Pathways to Justice project was a 3-year partnership between Be the Peace Institute and the Nova Scotia Association of Black Social Workers. It was funded by Women and Gender Equality Canada. And that connection was forged through Wanda between our 2 organizations. And it basically looked at how women subjected to intimate partner violence find justice in the responses they face. What was kind of shocking at the beginning of that was when we looked for, through the literature, to find how intimate partner violence affects Black women, we found virtually nothing about them, their children, their families, their communities. So our colleagues at ABSW used their kitchen table talks in several African Nova Scotian communities to find out more. And as many of you would know, the barriers, the risks, the consequences of reporting intimate partner violence, if you are Black and your partner is Black, are significant. For us, as I said, it set us on a path of really understanding, trying to understand deeply, and becoming authentic allies, but more importantly about this project that we're talking about now is building a body of knowledge that makes these realities not only more visible for more people, but contributes to the urgency to address the pervasive anti-Black racism that underlines these dynamics. You can see that kitchen table talk report on our website, bethepeace.ca, on the project page for Pathways to Justice. And there's also a documentary that we may talk about this afternoon about that project. Thanks.
Thank you, Sue. So in terms of the overall goals of the project, it was to contribute to new knowledge on the support systems and strategies that strengthen the capacity of healthcare providers and social service professionals to provide culturally responsive care to African Nova Scotians. And part of the underlying thoughts in relation to this goal is that we realize that very few people, less than 30%, report gender-based violence to the police. So often healthcare providers and social service professionals can be first providers. So that was part of that knowledge infused this goal. Okay, if you want to move on to the next slide. Okay, so we have 4 research objectives here that are going to be read by members of our team.
So the 4 research objectives, starting with number 1, how new learning from the impact of COVID-19 informs social policy and healthcare measures to better respond to gender-based violence within the African Nova Scotian communities. Abioa, you're next, I believe.
Yes, I am. Our second research objective was to see what cultural and structural factors contribute to the experience of family violence within the African Nova Scotian community.
Our third research objective was how can healthcare systems incorporate culturally appropriate programming, resources, and services to support better responses to gender-based violence in African Nova Scotian communities.
And our fourth research objective was what principles are required to guide innovative policy and health system innovations to become effective in responding to adverse childhood experience and gender-based violence in the African Nova Scotian community. Thank you.
So in terms of these large objectives, we collected data from variety of places, and our first phase that we deliberately chose to focus on was to connect with African Nova Scotian community members. So our research assistants did a wonderful job in seeking out people from across the province to speak regarding this issue, and you'll hear more about that as we go along. And then in phase 2, we're looking at, we did some preliminary analysis from the phase 1 to inform a survey. So we wanted to start with phase 1 so that we would get a preliminary information that would inform a larger survey. And that survey was collected from health and social service providers. And now we're in kind of in a third phase of data analysis of both sources, and we're positioned to, and this part today is part of our knowledge mobilization and dissemination. And this work is ongoing, and with that additional funding, we have opportunities to really dive into our data. And as I mentioned earlier, we're also going to produce film clips. Okay, the next slide.
So in phase one, we started with data collection from the African Nova Scotian community, and we invited adults, male, female, however you identified, of African descent, living in Nova Scotia, to participate in the kitchen table talks or the interview. So with the kitchen table talks, it was more like a focus group where the questions were asked and people spoke in group. We did them virtually because of COVID. And for those who weren't really comfortable with being in a group and sharing their experiences, we did individual or personal interviews with them. It was about 60 to 90 minutes long, depending on how the conversation went. And I would say it was really insightful, the things we learned from members of the community.
So out of that, how we recruited on Facebook, also through Twitter, community partners, sent out a ton of emails. The methods for the kitchen table talk. So what we got out of it, we interviewed 41 African Nova Scotian participants, and also just in the context of this research study, African Nova Scotian in the study is just anybody of African descent living in Nova Scotia. So in total for the 41, we had 36 females and 5 male participants.
Phase two of data collection was through online surveys focusing on health and social service providers. And so we recruited through, some of you might even have seen this poster or are familiar with some of the Twitter links through Facebook. A lot of the assistance and support that made it possible to recruit people happened by like contacts made with regulatory college or professional associations and the Nova Scotia Health Authority. So having access to email lists that could present this opportunity for people to take part. And so we had 194 complete responses, which I think is quite a lot, from health and social service providers in Nova Scotia. And so it was an online mixed method survey asking some demographics and statistical questions, and then some qualitative information as well. And so this is the phase three, starting some of the data analysis and just thinking about where are we with that. And so we've transcribed the 20 kitchen table talks. We've done an analysis was done to inform the development of the survey. And so that was really the first look at to make sure that the two sources of data collection were connected. We've completed a first round of an Africentric analysis that you'll hear more about from Wanda. And the survey data collection is complete, and you'll get some demographic and descriptive statistics that'll be presented today. And a deeper ongoing second round of analysis is really connecting the two sources is still ongoing. So in terms of who took part in the survey, the average age was 45.4, with a range of 22 to 78 years old for people that took part in the survey. 93% had a certificate or a degree from college or university, with 46% having a master's degree or higher. And so out of everyone that did complete post-secondary education, as indicated by the survey, 95% had done that education or training in Canada. 2% identified as genders other than male or female in the survey. We had 7% of survey respondents who identified as African Nova Scotian or African descent, 6% who identified as Indigenous, and then so 86% of the survey respondents identified as white. this is when we asked what your job title or your professional designation was. What 50, this is, sorry, this is numbers, not percentages. That's why it's adding up. So over 50 out of the 194 people that responded identified as social workers. And then the list of other included lawyers, legal assistants, dentists and dental hygienist assistants, pharmacists, administrative roles or supports, whether that range from paralegal to a secretary were some of the responses that were placed in other. Folks that focused on research statistics or that kind of specialist role, or spiritual care. And so it was quite a variety of people that were in the not listed category. Oh, I'm just experiencing, a lag on my computer, sorry. I've been turning my video off when I'm not speaking just so that I don't lose connection, but there is a bit of a lag there. And so when we asked respondents what things are part of your job description that you do kind of on a day-to-day basis at work, this is the percentage of, and so there's overlap. Some people you could identify more than one. And so this represents kind of the types of things that survey respondents were doing. The 3% other is listed on the side there. So case coordination, administration, private practice, or teaching in post-secondary education. And then how might you best describe your current workplace? 75% described it as working as an extension of or with the government. And so the way that healthcare is structured in Nova Scotia, that would make sense. And then we had identifies as working in the private sector, nonprofit, self-employed, and then post-secondary institutions was the response for not listed. And so that really brings us to where we are in terms of, like Nancy said today, as part of that knowledge dissemination and trying to really speak about all the work that we've been doing. And we're also in the works of putting together some short films. We've been meeting with a filmmaker who's been able to help take kind of what were the most meaningful, memorable pieces of the data that we've been collecting and really put these into a different form of data dissemination so that we can reach as broad an audience as possible.
And that is the fabulous Juanita Peters.
Yeah.
She's our filmmaker.
Didn't know if you wanted me to say that or not, but yeah. And so just moving on about Wanda, I'll turn it over to you.
Thanks very much, Stephanie, and for everyone on the team. It truly has been quite a journey for us. And it's already been stated a few times. I just want to repeat it again. This is a work in progress. We're still in the midst of data analysis. And with a mixed race team, and also a multi-generational team. One of the things that was really important was for us to ground this work in an Africentric analysis. So how did we do that? Well, first of all, we started with some teaching and learning around Africentric philosophy. You know, what is that? How is that informing our work? It's about centering the experiences. And with this conference, you notice that one of the things we did at the beginning of this conference was we created space for everyone to center themselves in the work. It's about being rooted in the African value system, which is those 7 principles of Kwanzaa or Nuzo Saba, those 7 principles. But it's also about developing that and fostering a collective consciousness, that notion of we're in this together, we are working together. And we do all of this work within an understanding of the deep structural issues that underpin all of our work. Okay, so we'll go to the next slide, please. So those key principles of Afrocentricity, again, that guide our work, sort of the focus on the center. So that centering is an important piece, and you'll hear that a lot. I think one of the most important things is seeing and making African people the subject of this work and not the objects of this work. So this work we were doing, centering the participants, centering participants' voices in this work, and making them the subjects of the work. So they are central to the work that we're doing. We started with the experiences of African people because we wanted to center their lived reality, valuing their lived reality. And at the core of this work is a recognition of anti-Black racism and how an African-centered approach or an Afrocentric approach can combat, can deal with, can address, gives us the tools to address anti-Black racism in this work. And you'll hear more about that a bit later. We'll go to the next slide, please. Excuse me. So part of this work is really when we were engaging in learning about how we were going to do it, we decided to start with the goals. So what are the goals of an Afrocentric analysis? What are we trying to do here? So initially it was really helping the team ground the analysis in the Afrocentric perspective. So helping people understand, but also embrace an Afrocentric perspective, and seeing that Afrocentric perspective as one that can be used by non-Africans as well as Africans. We were really clear throughout this work that we want to always be centering participants' voices. So making them the center of this work, again, tying back to the last point around subjects, not objects. We were also trying to decenter traditional Eurocentric ways of doing research. So how is this Afrocentric research different than those traditional Eurocentric ways of doing research that we've all been taught, that we've all been steeped in? So part of it is a decentering of that, which also means some unlearning of those ways of doing. So I've already talked about the need for us to center the experience and knowledge and honor those realities of this multidisciplinary team, but it's also an interracial team and an intergenerational team. So how do we bring all of those realities together in this work as we do this collective analysis? And in the early stages of the analysis, as was mentioned by Steph and Nancy, I believe, we were really, the early analysis of the kitchen table talks from community members was used to inform what we wanted to learn from the survey. So it's a wonderful movement in terms of recognizing first voices, using those first voices then to gather information from service providers, and then to move forward with that, to build. We'll go to the next slide. There's not a lot of there hasn't been a lot of work done on Afrocentric research, and not a lot of writing about the research process. But Ruth Revere, who spent part of her time in Nova Scotia, did some of her research here in Nova Scotia. She's done a nice piece that we were able to use in this work. So she's identified these two significant overarching pieces that we want to make sure we're dealing with in this work. So one is introspection, and the other is retrospection. So that introspection is that beginning with the centering of self, beginning with us all locating ourselves in the work, and also looking at what are those influences and things that are influencing this work and our analysis of the work. And then the retrospection is post completion of the analysis. And we're not there yet. We'll come back to that retrospection a bit later. But that's part of the work that will be happening as we continue on. We'll go to the next slide. So Revere talks about these 5 canons, and these are Swahili words. And we used these 5 canons in our initial analysis of the data, and we will continue to build on this work as we go forward. So the first, so for any Swahili speakers who are a part of this audience, forgive my mispronunciation because I know I'm going to make some mistakes, but I'm going to do my best. So the first is ukeli, which means truth telling. And the truth telling is such a significant part of our analysis, and part of that paying attention to participants' voices. What are the truths they are telling us? The second, kutoa, which means commitment, values, and knowledge construction. So we focused on the knowledge construction. So from that truth telling, what knowledge is being constructed here? What are we learning from the participants' voices? The third is utulva, having a having a justice-centered approach. And of course, in this work, we've been really focusing on that social justice approach to this work, that social justice analysis of the work. The fourth canon, Ujamaa, which means the community or the collective. And having bringing that collective lens to this work, understanding what participants are telling us from that collective voice, hearing and listening to that collective voice. And then the fifth canon, Ukaki, meaning balance and harmony. We struggled a bit with balance and harmony, and I think largely because we were seeing this notion of balance and harmony throughout a lot of the stories, but it was hard to isolate it in some of those. And of course, if you think about these 5 canons, you could actually think about balance between all 5 of them as people are sharing stories, telling us, giving us their information, and we're trying to make sense of the data. We bring each of these canons to the work. Revere goes on to talk about the fact that while as researchers, we're judging, we're analyzing, we're reflecting on this work through these 5 canons, so they remain central to our analysis of the data, both the kitchen table talks, but also looking at the qualitative responses on the survey, bringing these the lens of these 5 canons to all of that work. But Revere talks about 2 other sources that are important for the analysis and interpretation of the data. So that centering of self, bring our own experiences and how they are important, significant to our study, to what we're learning. She also talks about the need to have consultation with the wider community for guidance in interpreting the data. And so as we're presenting this work in progress with this audience today, you could be considered as one of our audiences as part of the wider community. We'd be really interested in hearing your feedback during the Q&A portion of this. We'll go to the next slide. These are the guiding questions that we asked ourselves as we were going through the first phase of the analysis. You know, what truths are being told? What knowledge is being constructed? What justice, if any, is being recommended? You know, what are they telling us should happen? It's one thing to say, this is the problem. It's another to say, this is what we should be doing about it. Is there evidence of collective or community voice in the transcript? Is there balance or harmony, or is that missing? And then what's the key message? We always wanted to come back with every transcript that we reviewed. We always came back to that question, what is the key message being shared by participants? What's the key, the focal point of the story? And the next slide. And I think I'm handing that over to...
I have it, Wanda, thanks.
Yes, thank you.
So as we were looking at all of this data, and those of you who do research would know that's a gargantuan task. There were three themes that emerged for us as quite important. One is the theme of the experiences, direct experiences of Black women seeking health and social services, both related to intimate partner violence and unrelated to intimate partner violence. The second was the notion of suffering in silence that Black men experience. And we have used these terms over and over, this everyday racism or regular racism that is a big contributor to this and rose to the top quite significantly. And also the perceptions of health and social services and the accessibility of services that are culturally responsive. So we'll share some quotes from that material next.
Okay, so I'm just going to be sharing a quote that was said during one of the kitchen table talks. So it was the experience of Black women. And this quote is in response to the question right now, based on your experience and knowledge, what role do you think health and social service currently has in responding to gender-based violence in African Nova Scotian communities? And this respondent said that this is a hard question to answer. There's a lot of victim blaming, and there's not enough support and resources when it comes to supporting those that are experiencing gender-based violence. But it's so much deeper than that. And it just takes accountability when someone is experiencing gender-based violence. The system just doesn't work for the victim. They work for the person that's committing harm. And because it's so deep, accountability is just not there. And then it turns into this whole ripple effect of traumatization and increasing mental health issues, which could all be not necessarily solved all at once. But if people learn to just listen to the victim, I think we could be way better, but we are far from that. So when we were coding this, we thought that this really spoke to the truth telling and to the justice-centered approaches. So yeah.
So this next quote was part of a response to question 8, where we asked if, do you think the healthcare and social service systems are well equipped or prepared to support African Nova Scotians with the issue of gender-based violence? Why or why not? And this was part of the response from one of our participants, and they stated that the system was focused on 2 units. Like that question was focused on 2 units, which was healthcare systems and social services, but we kind of did not refer or point to the elephant in the room, which they saw as the justice system, which has a bigger impact on members of African Nova Scotian communities and how the issue of gender-based violence have on what the issue of gender-based violence have on the lived experience of racialized families. With the justice system, we know that the justice system and the Black communities are not the best of friends. We know that, and then family in Black communities is like a core value in Black communities, and there's always been like a tense relationship between law enforcement and Black communities. The legal system also has in many ways not treated Black people fairly. There's always an over-reliance on the criminal legal system to respond to issues of gender-based violence and other issues within the Black community, which are usually harmful to members of the Black community. Often, Black people are often racially profiled or misrepresented by the justice system. A little issue can be blown out of proportion and consequences may be bigger than what the issue is. There's also the stigma on the family or on the person who is the survivor of the gender-based violence. Like sometimes people would rather not seek help for abuse because they know that the outcome of reporting will be very severe on the person they reported, or they would also face backlash from the community, and families are eventually financially or socially displaced. And there's a lot more on how the justice system has not really been fair to Black communities.
I think this is me. This quote here, Dr. Wanda and I both resonated with and felt it to the core. It's actually longer than this here now. And just that piece, a little bit, I die a little bit inside. This is in response to a Black male going to healthcare providers and how they feel, how they're treated, how they don't give all full information. Maybe when we should. I'm going to say we on that. This speaks to how the navigation is different for Black males in society. This speaks to where the negotiation is different. The communication is different. Yeah, this one here struck me, in my heart. This quote here, because he talks about it, children, his children. Yeah, that by the personal presentation, that the people, it goes right to the core, which is the thing he cares about, which is his children. So yeah, next slide, please. I think there's another quote that I can speak to. Yeah, and I know, and this is something that dismantling of white supremacy is key. That says it all, really. I mean, it talks the social construct, the Euro ways we do things, and the way we were taught, as Dr. Wanda says, the way we were taught to go through systems. Yeah, this is sort of explains some of the why and the how questions, the W questions. Yeah, thank you. And I later on, I hope there's some questions where I can maybe flesh that out better.
Thank you. So I am going to be sharing some of the quotes that we got from some of our research, especially when it comes to the perception of health and social services. So these are quotes that our participants spoke to when we asked them, how do they kind of view health and social services? How do they, what are their experiences have been like? So the first quote at the top of this paragraph, we kind of categorize that as a truth telling of one of our participants. And this individual stated that it is not a priority to make sure people are culturally responsive in the healthcare system. And so until we can change this institutional mindset in terms of how culture impacts our health, our mental health, our physical well-being, and all of these things, I think that the system can adapt to that unless it's changed from an institutional standpoint. So when we ask one of our participants, what do you see social service? And this is kind of what they spoke as their truth telling, is there needs to be, you know, a mindset, an institutional mindset change in order to do that. And then another participant also, when we spoke to them about this, their perception as well of the social services and healthcare, they said, to me, culturally responsive care, to me, it means that care should be given to people with respect of their culture, their background, and their identity. And I feel like in a lot of situations that I have been in personally, I don't get that. I don't get response because a lot of people, they respond in a way as if we're all the same and we went through the same things, all experience the same thing in life, and how we deal with the same thing and we all deal with the same thing is not the case. And that's where I feel like we don't receive, especially people in our community, we don't receive culturally responsive care. I guess that's where I should go wrong. So this participant here is talking about their experience when seeking care. Is there's always that kind of one model fits all kind of idea that is put into the system. So they feel that and they experience that their own personal knowledge, their own personal experience is not being taken into account when, you know, they're seeking services and where they're looking to be supported. And we're going to just go to the next slide there, Steph. Yes. Yeah. So for the next slide here, also when asking another person of their experience in the justice system, and this is kind of what they said, right, when it comes to the justice being recommended, they were saying this is something, so I'm just going to read that. It says, I think there needs to be a complete overhaul of the institution and the system. It is not going to do any good. It's just one individual in an institution that is pushing for change or being a champion in the organization. There needs to be a complete accountability from top down in all the way, in the policies, in the procedures, in the programs in every institution. If you want to actually make an impact, from my perspective, it is the only way we're going to get close to trust, because right now there's a lack of trust with the Black community, specifically African Nova Scotians, with almost every system and every institution. And that is because we are creating a Band-Aid solution. And what needs to happen is complete diversity on it. In every single, sorry, let me just finish that there. And that's because we are creating a Band-Aid solution. So what needs to happen is a complete diversity in it. In every single one of the institutions need to change the front line. So this is something that an individual kind of brought up as a justice recommended on how the service system can be changed and can be improved. And I'm going to pass it on to Steph.
Thank you. And so these are some stats from the early data analysis from the health and social service provider perspective. So it's from the survey. And so 96% of people who stated that culturally responsive care is important, 15% said that their workplace didn't offer it, and 34% didn't even know if their workplace offered it or not. And so even though there's a blanket statement around, yes, we believe it's important, there was still quite a gap in then even knowing. So that speaks to a lack of potential awareness, education and training, spreading and doing that work from an institutional level, or it could be individually not going out and seeking what is available. So there's probably multiple reasons, but there's a disconnect there. And so 59% of providers had culturally responsive care. They had the training that they had attended in various, we didn't collect the specific method or the type of training. We asked, did you have training? And so 40% of people who said, yes, I did, they said that they found it helpful. And so that means that out of everyone who took training, there's a large percentage of people that actually did not find it to be that helpful, which is a problem also. And so if we're looking at training and individual solutions and thinking about, it really speaks back and connects back to the quotes in terms of, we need institutional overhaul. We need systems change. We need that trifecta approach, the three interconnected. And so I think this quote from a service provider perspective would confirm that. And so 50% of respondents indicated that their workplaces had policies on how to deliver culturally responsive care. 31% felt that they were relevant, and the rest said no, they were not relevant, or they don't know. They're not even clear. And so that's quite, so we're already down to 50% of people who even have a policy. And then it's quite a bit lower when you then start to subtract how many instances where it's relevant. And so what's the reason behind deciding whether it's relevant or not? Is it hard to use? Is the right content in there? Is it applicable to the workplace? So there's a lot of unknowns, but what we do know is what exists. We need to do more work. And that's also what the folks in the KTT, in the interviews were also saying, the kitchen table talks. And so even though 96% of respondents saw culturally responsive care to be important, 1/3 did not know if their workplace offered it, and only 5% of survey respondents reported no barriers to asking how racism impacts the health and well-being of African Nova Scotian people. And so when we know and understand that connection to race and well-being, that needs to be part of culturally responsive care, only 5% of people reported no barriers, which we're interpreting as those are probably the people that would be asking about it. 5%. So with that, we'll move on. The next one's yours, Nancy, I believe.
Yes. So as we went through the analysis of our data, initially, we wondered if people were asking clear enough questions about gender-based violence, or what was going on, because what seemed to happen is that the issue of gender-based violence slid down the list, and the issue of racism came to the top in terms of what people spoke about in terms of these individual interviews. And I believe that we could say that that's one of the major findings of this research project. So while we were talking and referring to gender-based violence as a shadow pandemic, obviously the impact of racism is also a shadow pandemic. And when you think about everyday or regular racism, the words and that concept, it has profound implications for the way we deliver our healthcare and social services. So what we learned also is that it suggests an urgent need to move away from individual analysis in interventions to address the structural causes of gender-based violence. So if we could have the next slide. So many of you in the audience may be familiar with the power and control wheels. They have been used to help people recognize what is violent behavior, and also signify that often the need for power and control is a motivator for offenders of gender-based violence. And what our research initially, this is an ongoing analysis of our findings, but for me, what our research indicates is a centering of that structural and cultural violences that people experience in their everyday that contributes to stressed environments and to gender-based violence. So as I said, this is preliminary analysis, but it does make us question the way the power and control wheel is portrayed. Okay, next slide.
I believe this one is Wanda's slide, Nancy, if that's what you're...
Yes, over to you, Wanda.
Oh, sorry. They literally were just calling the vote on something. Oh, my goodness. So at this point, what we want to do is to try to connect the dots. And as we continue with our analysis, we continue to center our own experiences in that work. We continue with the centering of our participants. We will do that wider community consultation, and we'd be really interested in hearing thoughts and questions and suggestions that you may have as part of that wider consultation. We will engage in that retrospection as we continue with our analysis of this work. And we will continue to center them in these 5 canons: so justice and knowledge and truth-telling, that collective voice, and balance and harmony. So as we continue, I just want to repeat the last comment that Nancy made with regards to that emerging analysis around shifting from that individual focus to looking at some of those root structural causes. And in the case of specifically African Nova Scotians, looking at anti-Black racism and its impact. That's very central to this work. We'll go on. So what do we do? How do we move forward? And we will come back to this conversation around advocacy at the end of the day, but we really want to encourage and invite you to start with this end conversation around advocacy in mind. So as we move through the rest of the day, we want you to think about the 3 Ps, the personal, the professional, and also the political. Thinking about those 3 Ps and tying advocacy actions to each of those. What actions? Maybe some of you are already engaged in actions that may be addressing these issues, or you may be thinking about actions. But what actions do you or might you take? Looking at the individual level, but also looking at organizational level, or looking at systemic levels. So where are you? It's very easy for people to see this as someone else's problem to solve, but we want to be encouraging everyone to think about this in the broader context. What can I do? What can my organization do? And what do we need to do across systems? We want to increase access to culturally responsive care. We clearly heard from participants, this is not happening. This is not happening nearly enough, and it's compounding problems. We must reduce gender-based violence. So how do we do that? And we also must make a commitment to the dismantling of anti-Black racism, and that's not a problem for people of African descent to solve on our own. We need everyone to be a part of the solution to the dismantling of anti-Black racism. And we'll go to the next slide. And this is the best part of the presentation, I think, when we get to hear your questions. We get to engage with you. Okay. So we'll hand it over to our moderator, I think, to facilitate.
Absolutely. So please write your questions down in the chat or raise your hand so that we can ask questions. Let's take this moment also while people are writing questions to thank our speakers for sharing so much about what they did. I know that there was one question that already emerged that was saying that people wanted copies of your PowerPoint because it has been so powerful.
And if I could just interject for a moment, in addition, sometimes people say, well, I don't know if I have a question. We'd also be interested in your feedback, your comments. So it's comment, feedback, but also questions. So whatever's moving you at this moment, this is a time when we get to hear from you. Thank you.
So we have one question already. Thank you for the work that you have undertaken. We are interested in knowing how we can help lift up the work.
I'm going to take a stab at this if no one minds. Something I've learned in this process with this incredible team that I work with here is friendship versus allyship. And I'm kind of a storyteller kind of guy. To me, a friend says, if you're going into surgery, good luck. I'll be there at the end. You can do it. An ally goes, what time do I pick you up for your surgery? Where's your shoulder? I'm going to put my shoulder next to yours. You're not going to be alone during this process. We're going to do it together. So that's where it starts, by being looking at that word ally, and if you feel it, being that and doing that.
Thank you so much. So we now have another question. If I'm under,
can I just jump in and add something to
please.
that response? Just building on that, that question around what can I do? I would say part of what you can do is actually start having, if you're not having these conversations, the stats around the people who have training but not quite sure what to do with it, that's concerning. That should be alarming all of us. So I would say one of the things you can do is have these conversations in your workplaces. Mm-hmm. Many of you who are on this call may have been people who've completed that survey. If you were one of the people that completed that survey, let's do some reflecting on that and the meaning of the meanings of the analysis of the responses. What do they mean for your office? What does that mean for your team? And have those conversations. I think that's a really good starting place.
I would, and if I could also offer that there are so many resources for white people to understand how they can unlearn, relearn, connect, stop the kinds of conversations that are offensive. And we have a whole list of them. We've been doing a lot of webinars, and there are books, and that is a very important part of what any of us can do.
Thank you. Any other awesome researcher want to jump in? I know that your process has been a huge part of this as well.
I'm just going to chime in for a quick minute. Just with the team, like what we said about our diverse team, like I know on a couple Zoom calls, I shared some two incidents in particular that had to do with racism that happened in 2020 during a pandemic. Because I believe in transparency, and because the average person doesn't see it. And if we don't talk about it, sometimes people have their rose-colored glasses on and they don't want to believe that it's happening. So I feel that I'm always very vocal with what's going on with me. And I just make sure to make people aware that racism is still it's going on every day. We deal with it all the time. So whether it's in those systems, whether it's in the grocery store, it's all around us. And I just really think that it's important to share that and let people know, especially people that don't look like me. And sometimes you have people that are willing to ally with you and you have the ones that don't, but I'm gonna share my experience and let that person make that decision on what they want to do for me and the person that they claim that they love. So.
Nancy, I wasn't sure if you were wanting to share a few.
I was just nodding my head because Trisha has shared some experiences of racism with us. And while we think that we know and validate those experiences, when someone shares what happened to them, it's very moving. And I think we need to lean into that, not look away.
Thank you. I know that a lot of this is going to be a topic that we will continue to discuss, and there's also the researchers will be coming back to share advocacy components afterwards. There was another question. If I'm understanding, the research did not also highlight the impact of gender-based socialization as another root cause of gender-based violence. I don't know if anyone wants to address that question.
I think we can all agree that we live in a culture that has been infused with misogyny, patriarchy, and challenges for all of us to navigate healthy relationships. And I think as we continue to analyze the data, we'll be more prepared to answer that question. But I don't know if anyone else on the research team wants to jump in there.
I just had a thought. It's like that wasn't, I would agree with what Nancy said, and it's not, the study itself wasn't asking questions about like the experience or understanding of socialization. And so holding those realities that they do exist in the analysis is what is still to come. And so, you know, looking at the gender identities of the people that participated, and then the nature of what they share, and what is that kind of, like, they're not disconnected, whose gender identities are or not included in sharing of these stories. And then what does that mean for an interpretation from a gender-based analysis? And so your point is well taken. It's absolutely something that we're considering and is front and center as we're moving forward with the data. Yep.
Thank you. And there's actually, I think, a corollary question to that, which is wondering about future directions this research might go. In particular, are there plans to have more input and feedback from youth and or queer populations?
This might be an opportunity for Steph to wait, just to say a little bit about the future. This project has led to additional funding applications where we hope to engage with youth and to bring in multiple perspectives, and certainly the queer perspective. And we have submitted further grant applications, and we see this research program as having a lot of potential for knowledge mobilization. And so we're going to continue to seek funds and kind of continue to roll out that our findings. I don't know if anyone else wants to jump in there.
I would say there's lots of opportunity to partner. So if people are interested in that, we're well aware that a lot of the research focuses on a heteronormative approach and view, and that we know much less, and there's much less literature in terms of how it affects more gender diverse people, and that's definitely needed.
Thank you. There's also a question. One of Robert Wright's recommendation from the Desmond Inquiry was a culturally responsive domestic violence supports, such as transition help for African Nova Scotians. And the question is, does your research support this need?
If I could just rereading the transcripts, actually, one comment, you know, we ended asking participants, like, if you could make a change or a suggestion, and a culturally responsive, a trauma center specific for African Nova Scotians was a direct ask. And so then, yes, our findings would support that need, I would say. And so I just also wanted to tie that in to like the question around the LGBTQIA+ community also, and thinking about like what Sue said in terms of a heteronormative perspective and what we know and what we don't know, and including that into the analysis. But I also, when I think about the term gender-based violence, expanding what that means. And so we know we have an interpersonal violence and domestic abuse that we focus on, that is a large, you know, something that can trigger the involvement of the justice, the police involvement, even when you're going for support for a health issue. It happens with the Department of Community Services also. But gender-based violence moves beyond that. I think it includes that. And so when we think about gender-based violence as any type of violence or negative reaction that somebody experiences as a result of their identity, who they choose to love, those are things that we really need to, I think, moving forward for myself is going to be a focus. Because like Nancy was saying, these structural and cultural violences that are at the center include domestic and interpersonal violence and so that's where my brain's at with that.
Thank you. There was a question about survey questions being available. I think that probably goes along with the PowerPoints. Anything that the researchers will be making available to us to share. If you registered through Eventbrite, you will have lots of opportunities for follow-up. But I don't know if anyone wants to say a word or two about the specific survey questions. There's a couple of other questions as well that we want to address. Okay. Justine made a comment that I think is a piece that needs to be highlighted enough is that our community members don't feel as if the current standard for cultural competency is enough, which certainly is something that you all highlighted. We know that first voice is the most powerful way to support someone. And I think there needs to be a bigger push from organizations to engage and educate Indigenous African Nova Scotians, those born and connected to the 50 African Nova Scotian communities. Lived experience is always better than something written in a book. Sorry, I'm trying to like scroll down to read it. Oh, that's it. That's the end of the question. So the issue of cultural competence and how to build that awareness, certainly your research, both the process of the research that you described, as well as the findings and outcomes support that. I don't know if anyone has any comments that they wanted to share based upon that.
I don't know if this is answering the question, but one of the things that came, a message that came loud and clear from the data was that to have is centering people's experience, and to be able to do that, we need to make the time to hear people's stories. And many of us can relate to the fact that when we go to see someone in social services or healthcare, it feels like a bit of like we're so rushed that it's difficult to even feel that we have the space to provide our stories. So within the African Nova Scotian community, when you think about those principles and canons that we mentioned, it takes a reframe in terms of how we look at a person, how we respond to a person, how we take the time to hear a story, and our willingness to engage in that way. So in some of the system delivery, I think, is at question, because you know, if you go and wait 12 hours and emerge, or if you if you feel like you have 15 minutes and you can only talk about one issue, how can we possibly offer the services that people feel they need?
Just to add a bit to that, I think what it came to when it comes to hearing the voices, kind of similar to what Nancy said, is there seems to be a time constraint when our participants spoke, when they went to visit, you know, social services, like you have 5 minutes, you have 10 minutes, you have 15 minutes. So a lot of times there's this kind of one model fits all ideology that's used and doesn't allow for participants to really share, I believe, their personal experience and to really allow for their voice to be heard, so that they can be culturally, you know, they can be treated in a more culturally responsive way. And I think that kind of tied up, I believe I saw a question in the chat when it talks about, I believe if we cannot continue to address gender-based violence without addressing racism, just to speak more kind of towards that, is I think what we notice in our data is that it's not saying that racism is a bigger issue than gender-based violence, but when people want to seek resources, one of the biggest barrier has been racism, right? So for instance, when we spoke to the Black men and stuff, as a Black man, when you go into a hospital, you go to seek service, what people see often is your color, right? So behind that, you have to now be thinking, okay, how am I gonna act? How am I gonna, behave in a way that doesn't become violent or people don't deem me as a threat? So what we're trying to, I think what we found is that racism has become a barrier even to when women go to seek services. The first thing often is police. And we know that historically with the Black community, police and the Black community is not, our relationship is not strong. There's a lot of things. So I think what we're looking at is that racism does have to be addressed, and racism does need to be kind of at the, in a way, not at the forefront, but it has to be a big thing that is spoken about when we want to specifically address gender-based violence, looking at the Black community.
Thank you for speaking to the intersectionality and that additional question, which I was getting ready to ask about. Does anyone else want to respond to that additional question?
I want to just add a little bit to what Divine said. It is so true. Like people, it's like you go to a doctor's appointment or you go like, people sometimes that's what they look at first, or your color, or they're judging you based on how you're dressed. And I know with what Dennis had read on the slides about like the Black men, like it was basically somebody that was going, I think, taking his daughter or something to an appointment, and he searched in his closet for like ever trying to figure out what to put on, what was appropriate, how would somebody look at him based on his image. And he said he died a little bit inside, because those are the type of things as a Black person or a person of color that you have to look at before you even step out into your environment. Like it's exhausting. Like some days I just don't want to go anywhere because I'm like, what am I going to deal with today? And that's my reality. And I actually had I had an appointment with a specialist probably a couple months back. And just a prime example, like this is a professional in a facility in the hospital. And one of the things he said, he's like, oh, what do you do? He's like, I came in here and I'm trying to figure you out. And I was like, it just, for me, it's like, that's the type of thing. That's exactly what we're talking about here. So I just wanted to chime in on that.
Thank you. And there's a comment in the chat about white social workers needing to face white fragility and their fear to speaking up, and deeper conversations. There's some awesome chat, which is why if you're watching this after and just watching the video, you're not engaging in some of the deeper conversations that are happening at the same time. We are at 1, but I don't know if anyone has any last comments before we break for lunch.
Yes, could I make a comment on white fragility, please? Yes. I want to just say this. White fragility, the fact that there's a book that became a bestseller after the murder of George Floyd is absolutely astounding. It provides such a wonderful excuse for people. We need to get over it. There's no such thing as white fragility. When you live with everyday racism, white fragility cannot be one of your concerns, should not be one of your concerns, yet it always is. Thank you.
Thank you. And sadly, a very important thing to be reflecting on today is the officer who murdered Breonna Taylor in her own apartment got determined to be free by a jury. So the ways in which structural racism continues to be manifest is profound, and something that we need to absolutely recognize, that Black lives matter more than white feelings.
Black lives matter more than white fragility.
Yes.
Let's get over it. You know, people stop speaking because they're afraid of being hurt. But when you stop speaking, when you don't engage, when you're not involved with the work, it actually contributes to the problem. And I think people who are hiding behind white fragility, I don't think that's their end goal. So let's look at how you feel, how you have that fear, but you deal with it. The book, Me and White Supremacy, I think is a much better tool to help people deal with white fear around anti-Black racism.
Thank you. Nancy, you look like you unmuted yourself.
Oh, I just wanted to say that I'm so pleased that all of our team came today and presented and added to this rich conversation. And I know it can be, when you think about it, it can be pretty daunting to present at a conference such as this. So I think they summed up some courage to do it. And I just want to thank everybody for participating in this presentation. Again, like, our research assistants are awesome, and this team has been terrific.
What a perfect note to end on, with Dennis closing us off.
Yeah, something that my mother said to me, I'll leave you guys with today. I love my mother so much, is, Dennis, don't mistake my passion for anger or power. And, I think that slows people down sometimes. When you sit in a puddle for a long time, you're coming out, with mustard. You're not angry or you're frustrated. And please keep that in mind. We live in an uncomfortable world right now. I mean, look, everybody's feeling what's going on. There's a war going on. We're impacted by everything. Take that risk. It's worth it. High risk, high reward. That's it. Thank you.
Amen. And with that, we will be pausing for lunch. Feel free to continue using the chat if you wish.